From the very beginning of our lives to our final moments, genuine care and compassion from others is vital to our quality of life.
Hospice care is to make sure every day is as good a day as possible.
The folks that are involved with hospice and the organization and the mission of hospice is there to comfort and to take folks and encompass them in whether it's the physical, the spiritual, the emotional, the whole aspect of the person with dignity.
Cedar Valley Hospice was created by members of this community who saw a need for compassionate, dignified, end-of-life care and came together to create Cedar Valley Hospice. The team of Cedar Valley Hospice professionals is guided by our mission and belief that compassionate care is not just a phrase spoken, it's a way of living and working every day to help and care for the patients and families we serve.
The last 3 months we had her at home and taking care of her, and I thought we need all the help we can get. We could call even if it was in the middle of the night, and it was wonderful to have that support.
My husband and I chose Cedar Valley Hospice because it has been in the area for years, with an office in Grundy Center, our home.
Since 1979, Cedar Valley Hospice has been providing comprehensive end-of-life care and serving your family, friends, and neighbors with dignity and respect.
I was on the receiving end of all their devotion to me as a patient. I wasn't a number, I wasn't just a patient, I was a person, and my family were also part of that.
The focus of the compassionate, interdisciplinary team of professionals at Cedar Valley Hospice is the comfort and care of each patient. The team of doctors, nurses, social workers, spiritual care counselors, aides, and volunteers listen and respond to the needs of each patient and their family members.
There were professionals involved in many different aspects. Not only the doctors, the nurses, the well-trained staff, and the dedicated volunteers, but also the music therapist. She has brought so much joy into so many lives.
Beyond the care team that visits patients and families in their home, Cedar Valley Hospice also offers the Hospice Home, located in Waterloo. There, our highly trained staff are available 24 hours a day for inpatient or respite care.
Our experience with the Cedar Valley Hospice Home was definitely different than what we experienced at the hospitals. It was much more personable.
I think a lot of times people think that when you go to hospice, it's like you're in a hospital or a hospital type of setting, and it's totally different. The layout of the facility, being able to have access to a kitchen, patio, grills. It allowed my family to come in and to make that bond, to give us all our strength.
Cedar Valley Hospice also provides other services to the community, including grief support for both adults and children, palliative care services for those who do not yet qualify for hospice through LINK, and medical case management to those living with HIV or AIDS.
They know what works and what doesn't work, and
they've been here, and you know they're going to be here. Their record speaks for itself.
Cedar Valley Hospice's grief services are available to support adults and children. Because children grieve differently than adults, there is a specialized program available for children called the Eucalyptus Tree. Both services are open to anyone in the community and provide support and education on serious illness, death, and grief. The LINK Palliative Care Program provides supportive care to individuals with an advanced illness and can be provided along with curative treatment. LINK stands for Listen, Inform, Navigate, and Knowledge. A nurse and social worker from Cedar Valley Hospice work with clients, providing communication and help in navigating the healthcare system. Cedar Valley Hospice also offers the Cedar AIDS Support System, or CAS, providing medical case management and care for those living with HIV or AIDS and their loved ones. Cedar Valley Hospice is well respected. However, many people still have questions and are hesitant when the time comes to discuss hospice care.
I felt that it was time for my husband to go on the hospice program. He felt that he wasn't ready. He didn't like the word hospice, thinking that meant death, that meant dying. But I told him I needed to talk to Cedar Valley Hospice personnel about our situation. So I did. And they prepared me for perhaps what I could go home and relay to my husband. And it wasn't very long before he actually said, I'm ready now. I'm ready for Cedar Valley Hospice to become a part of my life too.
Personally, I think as a family, we waited too late because we just never thought that he was going to leave. I wish we would have contacted them earlier because it would have took a lot of pressures off us as kids.
It's very easy if you think you have a terminal illness or you're really having problems to have an evaluation by Cedar Valley Hospice to determine if now is the appropriate time for admission to the hospice program. And they can determine, based on their expertise, if it's too early or if it's the right time.
That I think is important to take a look at Cedar Valley Hospice is it's a nonprofit organization. It's not there for the profit, for the almighty dollar. It's there for the benefit of the folks who utilize the services. And so it's a mission-driven organization, and those folks are very much, as I say, very passionate and very compassionate with the family members and with their patients for the right reasons.
Cedar Valley Hospice is a not-for-profit agency with office locations in Waterloo, Grundy Center, Independence, and Waverly. We provide services to those with a life-limiting illness in their own home, in a nursing or assisted living facility, hospital, or at our hospice home. Services are offered to anyone regardless of age, diagnosis, or ability to pay. When it's time to discuss hospice care, you have a choice in providers. Choose Cedar Valley Hospice, where you can be surrounded by loved ones and cared for by the experts. Cedar Valley Hospice, making each moment matter.